Welcome back to Everyday Iowa. Well, last week I visited the free medical and dental clinic in Iowa City, the wonderful nonprofit that was established over 50 years ago. And now you have an opportunity to visit their newly renovated clinic as they celebrate with a ribbon cutting on October 8th. I spoke with their executive director, medical director, and director of marketing about how the renovation will help the clinic meet a growing demand for their services. So Jenny, remind everyone what the free medical and dental clinic is.
Great. The Iowa City Free Medical and Dental Clinic has been in Iowa City since 1971. We're thought to be the second oldest continuously running free clinic in the United States. Always here for the community, and the community has always supported us. And we are here for people who have financial barriers to getting health care, the uninsured, the underinsured, sometimes people between jobs, things like that. We're a safety net for the community. And we offer acute, chronic, and some specialty care along with dental clinics.
All right, so this, I think, is needed now more than ever, a clinic like this. Can you talk about some of the services that you provide here specifically?
Yes, so we provide chronic care, so people who have conditions such as diabetes or high blood pressure, asthma, and we can see those patients more regularly. We also see patients for acute problems on a now walk-in basis. This is a new thing for us, and so we are trying to figure out the best way to do all of that. We have a women's health clinic, which is one of the things that we've worked hard to be able to offer those services. And then depending on our resources, which is typically other providers who want to volunteer, sometimes we're able to offer specialty clinics. And currently we have dermatology, orthopedics, ophthalmology limited, and we have some optometrists in the area who donate free eye exams for patients with diabetes, which is very important. I can't speak much to the dental clinic because I am on the medical side, but I know that they are working to be able to get that up and going more regularly as well.
Mm-hmm. How does it work if somebody needs prescriptions?
So I guess it depends. If it's somebody who is not currently our patient and just walks in off of the street, we are no longer able to provide them with prescriptions because we really do have to see the patient as a clinic to develop that patient-doctor relationship to be able to provide the prescription. So if it is a patient who is here, we give patients medications as we are able based on our funding and our staffing through our dispensary here at the clinic. And we carry a lot of basic high blood pressure and diabetes medications. We have been fortunate that sometimes we are able to get patients on pharmaceutical assistance programs in partnership with pharmaceutical companies to provide medication for free. Otherwise, we will send prescriptions to whatever pharmacy the patient wants and discuss with them ways to get them for cheaper.
Have you seen a huge increase in people needing your services?
Yes. I will say we don't know how big the increase is because the demand is so much greater than our current staff and volunteer pool can provide. But we have to unfortunately turn people away every day.
Yeah. Which is another reason why it's important for volunteers and donations. We're going to touch base on that, but you're also opening a new clinic. Can you tell us about that?
So we have been in Iowa City since 1971. We moved to this building at 2440 Town Crest in 2006. Well, once again, we outgrew this building. It just wasn't set up to help us see as many patients as we needed to see. So we became the recipient of very generous grants from Iowa City, Johnson County, and a grant from Delta Dental. And we have completely renovated the entire space, which has resulted in upgrades and, more importantly, additions. So we moved the footprint around. We haven't added on any square footage, but we're using the space differently. So we have 3 more clinics. We've almost tripled the size of our dispensary. We've updated the lab for workflow. We have more efficient office space. We have a volunteer lounge. So when volunteers come in, there's some place for them to put their purse, and other places within the clinic that are just working much better in anticipation of and recognition of this growing need. We are so thankful for these grants.
And you have a ribbon cutting coming up. Could you tell us about that?
Sure. October 8th, which is a Wednesday, we're going to have the clinic open to the public from 3:30 to 6:30 with a ribbon cutting starting at 5:30 p.m. It's a great way to showcase not only the beautiful renovations, as Jenny had said, thanks to the City of Iowa City, Johnson County, and Dental, but really the work that Dr. Norris and the whole team at the Free Medical and Dental Clinic, as well as our volunteers. It'll be a nice event. Please join us if you're able. We would love to have you come see our new space.
Can you tell us how people can volunteer, donate, or if they need your services, how they can go about doing that?
You're welcome to always go to our website. One of the blessings of having one of the oldest, or being one of the oldest free medical clinics, is we have the website, www.freemedicalclinic.org.
Oh, wow.
So we have
What are the chances of that?
Exactly.
Oh, yeah.
So please just go to our website. There's links for donations, as well as a link to our volunteer coordinator with the different roles that are needed. And she will be able to navigate any potential volunteers through that process.
So yeah, there's so many other things that they can do to help. You three are seriously angels. Everyone that is at this clinic are just angels here on earth. Thank you so much for everything you do. And I know this service is needed now more than ever, and I'm afraid it's even going to increase. So what you do is so important. Thank you.